Let's bring in Dr. Anthony Fauci now for more on this. Dr. Fauci, thank you for joining us again this morning. You just heard what Whit said about Vice President Pence, but we heard from governor after governor yesterday, including Larry Hogan of Maryland, your neighbor, saying that the governors just don't have what they need now to do the testing they need to do.
Yeah. Well, certainly I can empathize with the governor and believe them. What we need to do is make a better connectivity with the tests that are available, as well as the capacity that in some cases is not used through no fault of the governor or the local people, that there are now should be between 1.5 to 2+ million tests per week. There are people out there who say we need more. We need maybe 2 or 3 times that. We're striving for that goal, but in the meantime, with what we have, if it is used strategically, we feel we'd be able to have most people enter into phase 1 after they pass that 14-day gating period. We know it's a problem, and was just mentioned, there are things that are obstacles in the way that, George, we need a partnership between the federal government and the local people, including the governors, to help them get to things that they maybe not have any access to. So it really does need to be a partnership.
So I was just saying, we know there are some supply chain issues, but you mentioned those experts who believe we need to be doing far more. There's a new study out from Harvard this morning that says we're going to need to be doing something like 5 million tests a day in early June to start opening, up to 20 million tests a day to fully reopen as soon as possible by the end of the summer. We're only doing about 150,000 tests a day right now.
Yeah, we're doing about 1.5 to 2 million per week. We really need to get up to at least, maybe 2 times that, 3 times that. But we will, as we go into the coming weeks, looking forward as regions, states, cities start to go from the gate to the phase 1, and then ultimately, hopefully, to phase 2 and 3. So we certainly going to need more. I think the issue, George, is that not saying that the people out there are not correct in what they feel they need, because they do need a baseline amount to do the kind of testing that would allow identification, isolation, and contact tracing. If you talk about tests for doing a lot of other things, which ultimately are important, but they're not absolutely critical to get to that situation where you can identify, isolate, and contact trace, there's got to be a meeting of the two. There's got to be more supply, greater access to untapped capacity, which there are. And, the governors do say appropriately, well, maybe there's untapped capacity, but how do we get to it? So we've really got to help them to get to it. And that's what's being done right now, to try to make the connectivity between what's unused capacity as well as tests within that capacity to help them. We've got to keep going, and it's got to be done together, really in a partnership.
Everyone is also wondering about antibody testing. We know that Governor Cuomo here in New York is expanding antibody testing. We've seen that overseas as well. But explain to everyone at home what those antibody tests can show and what they can't show.
Yeah, George, thank you for giving me the opportunity to address that, because there really is a lot of misunderstanding about antibody tests. An antibody test is not saying whether you have the virus now. It's saying whether you were exposed, infected, and likely recovered from the infection. What it is a measure of the proteins in the body that respond to the virus in question. The problem is that these are tests that need to be validated and calibrated. And many of the tests out there don't do that. So even though you hear about companies saying flooding the market with these antibody tests, a lot of them are not validated. Point number 1. Point number 2 that's important is that we do not know exactly what an antibody titer means. I mean, there's an assumption, a reasonable assumption, that when you have an antibody that you are protected against reinfection. But that has not been proven for this particular virus. It's true for other viruses. I think it's a reasonable assumption, so you wouldn't say, that's an absurd idea. It isn't. I mean, it happens with other viruses. But we don't know how long that protection, if it exists, lasts. Is it 1 month, 3 months, 6 months, a year? So the assumption that with the tests that are out there, if you have an antibody positivity, you're good to go, unless that test has been validated and you can show there's a correlation between the antibody and protection, it is an assumption to say that this is something that we can work with. We still have a way to go with them.
And finally, sir, we're seeing these protests crop up all across the country right now, including those protests in Texas and other places where they're saying fire Anthony Fauci. Fauci is wrong. They're resisting these stay-at-home orders from governors. What's your message back to those protesters?
Yeah. I mean, I think, the message is that clearly this is something that is hurting from the standpoint of economics, from the standpoint of things that have nothing to do with the virus. But unless we get the virus under control, the real recovery economically is not going to happen. So what you do, if you jump the gun and go into a situation where you have a big spike, you're going to set yourself back. So as painful as it is to go by the careful guidelines of gradually phasing into a reopening, it's going to backfire. That's the problem.
Dr. Fauci, thanks for your time again this morning.
Yeah, good to see you, George. Thank you.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.
Many of you at home simply want to know how and when will we reopen this country as we continue our series of reporting on what's next for America. Tonight, your questions: are we ready to reopen? Are they ready with tests to reassure us before we re-enter society, return to work or school? And can you catch this virus twice? The new headlines tonight. We get to all of those questions with this country's leading expert on infectious diseases, Dr. Anthony Fauci, who I spoke with before we came on the air tonight. Dr. Fauci, thanks for joining us here. And I know that everyone at home really just wants to know, when will America reopen? How will America reopen? We've heard from the president that in some places it will reopen perhaps after these 30 days, in some states even sooner. Do you agree with that? Is America ready to reopen?
I think we need to be careful, David, to make sure that we don't talk about America in totality, because there are so many different levels of outbreak and of involvement with this virus throughout the country, that there will be some areas of the country which will really be much more attuned to and ready to be able to get more towards normality than others. I kind of refer to it as kind of a rolling re-entry. So it's not going to be like a light switch that you turn on and off and say, on this date, America will resume its normal activities.
So regardless of time frame here, because you say it'll be a different time frame for different regions of the country, but regardless of the time frame, what needs to happen in order to reopen?
What you must be able to do is to have in place the capability of rapidly identifying by testing, getting someone who's infected out of the circulation, obviously taken care of if they need medical help, if they can be handled at home, do contact tracing, do it in an efficient way where it means something, not contact tracing many days after an individual actually is exposed.
Dr. Fauci, you've talked a lot about testing and tracing, that is a necessary component here. And with all due respect, the American public watched weeks ago when testing was really important in this, and the very slow ramp up. How do you convince them that we're going to be ready to test all over again to try to reopen this country? May 1st is just a couple of weeks away.
So, David, what I am hearing and seeing from the parties involved that are responsible for the upticking of the tests, making them available, is that we are doing extraordinarily better now than we were at the time when there really were some significant challenges.
Are you telling us that there'll be tens of millions of tests ready so that American families can feel confident about leaving their homes and going back out into public and re-entering society?
David, I can't guarantee that, and I can't tell you that for sure. What I'm hearing from the people responsible for making sure these get out there is that we will have, and it's not only just the federal government doing it, it's the private enterprise, it's the companies that are able to make and implement these tests.
Is there going to be a second wave of infection in this country?
We don't know that. I mean, I think we just have to be humble to realize that we do not know everything about this virus and what it's capable of doing. It is entirely conceivable that we will see a rebound as we get into a seasonal situation, such as next fall or winter.
You know, in the meantime, I know you're aware of these reports out of South Korea and even some anecdotal reports here in the U.S. of people coming down with this twice. Do we have any idea whether or not these cases are new infections or a reactivation of coronavirus already in the system? Are you concerned about that?
Well, David, I can tell you we do not know definitively whether these are reactivations or whether they are reinfections. You know, and also not only that, are these really rare outlier events, or is this something that is telling us something about the degree of protection? It's a challenge to find that out. The critical issue that's related to that people are asking, and it's important, is that when you are infected and you have an antibody, which is a protein that essentially fights the virus, and you have a level of antibody in you, are you protected? Namely, are you protected for a month, 3 months, 6 months, a year? Those are things that we have to find out, but we don't have the answers to that right now.
We know there's a handful of human trials underway for vaccines. You have said 18 months repeatedly. Is there any way to try to speed this up?
You know, the answer is yes, but not substantially unless you have certain conditions. In order to be able to get a vaccine that you feel comfortable will be safe, and I say not only safe 15 minutes after you inject someone, that you don't get sort of an allergic reaction, but safe in that it does not, if a person gets infected, actually make it worse. We may learn a bit earlier, a few months earlier, but I think any less than a year, I think anything less than that would be carving off a couple of months, but not a lot more.
So that essentially, Dr. Fauci, takes us right into next winter. And I know a lot of people watching, you know, are concerned about their parents, their grandparents. Does that mean we're going to have to be awfully careful with them and perhaps keep a distance from them all the way through, you know, next January, February, given the timeline you just gave me?
David, if we get a rebound of virus in the community, which, as I said, is possible, it may not happen, but it's possible. If we do, and we don't have an effective and safe vaccine available, we will have to resort to the public health measures that have really fared us really rather well in many respects in the challenge we're going through right now.
A very long road ahead. I also asked Dr. Fauci about antibody tests. He says when you have antibodies that develop in response to an infection, generally speaking, with few exceptions, you do have some immunity. Now, whether that's true here and for how long, he says, remains unclear.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.